We're ready for it. Okay, good morning. We're going to call the Health Services Committee on this the day of June. And with that, the first thing we need to do is to approve the minutes of last week's meeting. So I'd like to make a motion. Supervisor Gerasimus, second by Supervisor Rowan. Any additions or corrections to the minutes? Okay, and we'll go with it. All those in favor? Aye. Opposed? Carried. Good morning, ladies. We're all set.
Good morning to you. Just a few resolution requests today. The first one is to amend and renew our agreement with Strategic Healthcare Programs, LLC, allowing for a rate increase for the renewal term of 7/1/2023 to 6/30/2024. To increase the annual lump sum rate from $8,695 to $8,956, which is a 3% increase. To also increase the patient satisfaction survey rate from $2.25 per survey to $2.25 per survey. And that is reflective of an 8.8% increase. And then to authorize future annual renewal, provided there is not more than a 10% annual increase in the annual fee and or the service fee. This is attachment 1. Health Services Home Care has a contract with SHP to facilitate patient satisfaction survey. This is a requirement of participation. So we really, if we're not paying this vendor, have to pay somebody else. And the vendor advised us of the increased pricing. So that's why we're requesting it.
Okay, would someone like to move the motion? Supervisor Bruno, second by Supervisor McDevitt. Any questions for Janelle? All right, if not, we'll vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
Thank you.
Mhm.
The next resolution request is to amend Resolution 480 of 2021, authorizing the Director of Public Health and Patient Services to enter agreements and contracts to 1, increase the not to exceed amount from $10,000 to $20,000. 2, to authorize renewals with rate increases up to $10,000. Formerly, that was 5%. And to 3, authorize minor amendments in the form approved by the county attorney to reflect necessary verbiage changes or changes in resolution or regulations. Health Services utilizes minor routine and or emergency services from a variety of vendors and contractors for services such as, but not limited to, after-hour answering services, miscellaneous repairs and or maintenance, funding for small projects. The last resolution was requested in 2021 and the amount needs to be increased. Health Services will continue to always work with the county attorney's office to ensure that single contracts without resolution will not exceed the $20,000. Funding is already in the Health Services budget, and actions will follow current purchasing policy, except when we need to come to committee to ask for a resolution. And all contracts will be in a form approved by the county attorney.
Okay, let's move to make a motion on that one. Supervisor Ryan, second by Supervisor Smith. Any questions? Because there's a lot of information there. It seems like, but if everybody's good, then we'll vote on it. All those in favor?
Aye.
Opposed? Carried. Thank you.
All right, I'm going to turn the floor over to Tom because the next one is to transfer funds for the 2023 budget.
Okay, attachment 20, number 3 is, the bottom line is we have 40 cots that we purchased for emergency purposes. And they're just sitting in the basement and they're not, last time we were to move them out of the basement when we needed them, we had to put them in a garbage dumpster. So Dan found these carts that hold 8 cots per cart. And so we want to order 5 carts, so we are moving $4,000 out of salary. We have a nurse position that we did not fill since the beginning of the year, so we have that extra salary. So I'm coming up here to move some salary and some fringe down to other equipment to pay for these 5 carts. And again, they're down in the basement, and from what Dan said, that they're doing stuff down there and they need to get them moved, and trying to move them and trying to get it when we got 40 carts in a garbage dumpster. Just these also have, he says, a cover over them so we can store them. They won't get dusty, and they are from the same manufacturer that we got the cots, so we know that they'll fit in there. So that's, we got a quote and we wanted to get those ones.
Would someone like to make a motion on that? Supervisor Ryan, second by Supervisor Bruno. Any discussion? Can we vote on it? All those in favor? Aye. Opposed? Carried.
Okay, on to attachment number 4, which was our financials. We're working at the time on closing our for May. And I just wanted to note again, our salary below, you will see we're overtime. That's been reduced because last year at this time, we had COVID expenses related when it came to overtime and part-time salaries. Regular salaries have gone up due to the union negotiations and the increases last year. And so far, the beginning of this year, attachment, so we're at 27.03% of the budget as of, this was as of June 5th. And last year at this time, we were at 38.16. So that will give you an idea of where we stand regarding salaries. Attachment number 5, again, is our comparison of last year to this year. I try to make it as close to the exact date, including the payroll and everything. The biggest thing that is again our ELC grant, which is our school grant, or they gave us this money to get stuff that the schools need. You'll see in the equipment line, $168,004.80 is the purchase of air purifiers that the schools we were able to get for them. And then under the supply line, which would be under contractual, is where the supplies for those purifiers, the filters. But also we've bought masks and wipes, and we're in the process now of probably by the time of the next meeting of getting them these I guess they're sterilizers or something that will sterilize the bathrooms. And again, the supplies have been approved by the state. And also one school's asked for something that sterilizes the floors, and that's been approved by the state. So those are going to be big expenses we'll see coming up in the next few months. But so in both the supplies and equipment line, a lot of that is related. You'll see on the supplies alone, $293,355.02 is regarding the supplies that we talked about. They also got purifiers. They also got filters. They did open it up from just schools to camps and daycares. So that was nice. We've been able to help a lot of them. They worked closely with our staff to say what their needs are, and we've been able to get all those purchased and delivered. So this is reflective in these numbers now.
Thank you. We also attached our status of referrals, our emergency preparedness report, the rabies report. And I thought I would also, if I can find my notes here. We had a visit by the state health department right when I got back from vacation. And we had 2 of our programs evaluated. Same time, same dates. And number 1 was our WIC program. They interviewed staff, observed one of our clinics, happy to report no findings were found. Very much want to send out a shout out and appreciation to Pat Belden, Sarah Heddle, our WIC coordinator, and all of the WIC staff and our families for their efforts in ensuring our agency's compliance to regulations. The second survey was to our home care agency, our CHA. They interviewed our administrative staff. They did a joint visit. They reviewed our records, our home care records. They reviewed our policies and procedures. We had one minor finding in what I call a what if policy. It was concerning home health aides and the hiring of, and we don't have any. We've never hired them. We don't have the positions in our budget, but they wanted us to add a sentence in our policy. That was done before the surveyors left, and our CAP was submitted and approved. Again, I want to thank our home care staff, Val Wisnott, and our administrative staff, our nurses, support, and fiscal staff for doing an amazing job in making sure that we are following our gazillion regulations that we must do.
Wonderful. You feel good for such a good report, then.
Yes.
Great. Did any committee member have any questions?
I just maybe make an observation if I can. If one looks at the 2 larger communities in the county, that being Queensbury and Glens Falls, and it only proves the point that the nurses, the public health are providing quality, necessary, important medical services to people in need in Glens Falls and Queensbury. So we in the city, I can say we're getting some return for the buck. Okay, in terms of I have a next door neighbor, an elderly lady who lives next door, and I think every week I see a visiting nurse car pull up and puts in, spends time, takes care of Phyllis, and so it's I appreciate the service for people that have some issues, and so again, the city is, I think, getting some bounce for the buck in terms of services provided by Warren County. Thank you.
I'm sure likes to hear comments like that.
Yes. We don't have any meetings or conferences to report as of this minute. Committee. I usually get right back to my desk and get a few, but I think with our new policy, we don't have to report under 500, but I usually try to let you know. And that's all I have.
Well, thank you, but I always forget that this privilege of the floor at the beginning, so I'll do it at the end. Is there anyone in the audience that had any comment or question? Okay, now I'm going to entertain a motion to adjourn. Supervisor Drops, accepted by Supervisor Bruno. All those in favor?
Aye.
Thank you. You're welcome, ladies and gentlemen, the rest of the day. Thank you for all your hard work. You do.